Today we're going to be talking about breast implants and some of the newer techniques for breast augmentation. Now, if you look at social media, there are many different types of breast implants, different techniques, different names being presented to patients, and understandably, it can be quite confusing. One technique that we are hearing much more about at the moment is Preservé. I want to give you an honest opinion and explain what it actually involves, how it differs from more traditional breast augmentation, and importantly, who I think it may and may not be suitable for. Before we continue, I would be very grateful if you could subscribe to our channel and like the video. It really does help us to continue creating more educational content. My name is Dhalia Masud and I'm a plastic and reconstructive surgeon. So let's start with the basics. Why do we use breast implants? People have breast implants for many different reasons. For some people, it's purely cosmetic. They may simply want larger breasts or more fullness, and they feel that this will improve their confidence. For other patients, implants are used for reconstructive purposes. For example, somebody may naturally have underdeveloped breasts, what we call hyperplastic breasts. They may also have significant differences in size or shape of their two breasts, or they may require an implant as part of a breast reconstruction. Although reasons for having an implant may be very different and the techniques can vary, some of the basic surgical principles remain the same. So where exactly does the implant go? An implant can be placed in different what we describe as anatomical planes. Broadly speaking, it may be placed above the muscle, or underneath the muscle, or using a combination of both, depending on the technique. And there isn't one plane that is automatically good or better for everybody. The decision depends on many things: your own anatomy, the amount and quality of your existing breast tissue, the envelope, the implant you're considering, previous breast surgery, and the results you're trying to achieve. So it's a complex decision-making process, and that's why it should be made following a detailed assessment with your surgeon and go to an experienced surgeon. That's really important. The pocket is incredibly important. Whatever plane you decide to use, one of the fundamental principles of breast augmentation is to create an appropriate pocket that fits the implant like a glove. The implants need to sit comfortably and predictably in the pocket. If the pocket is unnecessarily large, there may be excessive implant movement and there may be problems with positioning and falling under the armpit, etc., and displacement, and with certain implants, rotation or flipping. Now, occasionally, if the pocket is too restrictive, the implant may not sit in the position or shape that we intended. So creating an appropriately sized pocket is an extremely important part of breast surgery. And before surgery, we therefore take careful measurements of the breast and the chest wall. We'll assess your width of the breast and the quality of your tissue and the dimensions of the implant we're considering. And we will order a whole range of implants before we choose the final implant. During the surgery, we will also continue to assess the pocket, and some surgeons assess this pocket using different ways. How is that pocket created before we put in the implant? Commonly, an incision is made in the fold underneath the breast or in the armpit, and the layer or plane where we put the implant in and where the implant is sitting is created during the operation using surgical dissection, most commonly, particularly with diathermy, which is a heated tip. We create this pocket progressively in a controlled manner and controlling any bleeding that may occur, and we're constantly assessing the plane and constantly assessing the pocket. Once we're happy with the pocket, the sizer is inserted and then the implant is inserted. We directly visualize anything, and this approach has been successful and very useful for many years. But now newer techniques have been designed to create this pocket in a different way. And this brings us on to Preservé. The Preservé technique uses a specifically designed system to help develop the implant pocket through a controlled expansion rather than a conventional wide dissection of an entire pocket. In simple terms, it means an expandable device is introduced into the layer or the plane and expanded in a controlled manner. This develops a space for the implant while aiming to minimize the surgical disruption of the surrounding tissue. You will sometimes hear this described as preserving the internal support structures or the ligaments of the breast. The concept is to expand and stretch the tissue to develop the pocket. Now, there are proposed advantages to this approach, particularly in the appropriately selected patients. However, I think it's important that we separate the surgical principle from some of the marketing terminology that surround it. Now, one of the things that I particularly like about Preservé is that the system has been specifically designed to create the implant pocket in a controlled way. In an appropriately selected patient, having a small to moderate sized implant, I think this is an attractive technique. However, there are important considerations. With Preservé, we are developing a pocket predominantly by a controlled expansion and stretching the tissue, rather than directly dissecting and visualizing the entire pocket. And that means I don't necessarily have the same direct visualization of every tissue and every small vessel as I would when creating the pocket under conventional surgical dissection. However, for small or moderate-sized implants, a relatively limited expansion is required, and I'm comfortable with that approach in the appropriately selected patients. As the patient's implants become larger, we potentially need to create a larger pocket and place great attention on the surrounding tissue, and this is where we become more cautious. This is exactly what the company says. When it comes to larger implants, it's not really recommended for them, so my feelings are in support of what they've said. And if I feel that a significant expansion or modification of the pocket is required, I prefer a conventional approach because I can directly visualize the tissues I'm operating on, and I can identify blood vessels and control them where necessary and deal immediately with any bleeding that occurs. That doesn't mean one technique is universally safer or better than another. It just means that the technique needs to match the patient, the implant, and the amount of pocket modification is required. And this is why I think it's particularly important to see an experienced surgeon who understands breast and performs different breast augmentation techniques rather than somebody who offers one approach. The question shouldn't simply be, can you do Preservé? The important question is Preservé actually the right operation for me? What do I personally feel about Preservé? For me, one of the attractive things about the technique is the controlled creation of the implant pocket using a specifically designed device to create the implant pocket. I've used different methods of sizing and developed pockets for many years, and Preservé provides me another tool that is specifically designed to create a pocket in the small to moderate implant. And in appropriately selected patients, particularly somebody having relatively modest augmentation, I think it's a useful technique. What about these ligaments that people keep on talking about? You'll hear quite a lot about preservation of breast ligaments when Preservé is discussed. Anatomically, that's interesting, but as a surgeon, what matters to me most is, and I think what matters to most of my patients, is the eventual outcome. Does the implant sit in the correct position? Does the breast have a good shape? Is the result stable? What is the recovery like? And what are the short and long-term complications? Preserving anatomical structures where possible is certainly attractive, but I wouldn't personally choose an operation because somebody told me that a particular ligament is being preserved. It needs to translate to a meaningful benefit for that particular patient. Can Preservé be done under local anaesthetic? This is probably one of the biggest attractions on social media. You'll see patients having breast augmentation described as being performed under local anaesthetic. And yes, selected breast augmentation procedures can be performed while the patient is awake, sometimes with a bit of sedation. But I think we need to be careful here. Local anaesthetic numbs the skin area. Sedation can reduce your anxiety and awareness to varying degrees, and general anaesthetic produces a controlled state of unconsciousness. Each has its own advantages, disadvantages, and safety consideration, and not every patient will be comfortable having breast augmentation under local anaesthetic alone. Even good local anaesthesia, patient will still experience pressure, movement, pulling, and other sensations during surgery. So personally, I would never choose Preservé simply because you want to avoid general anaesthetic. The choice of anaesthesia should be made separately based upon the patient, the procedure, and the appropriate anaesthetic assessment. So for me, Preservé is an excellent additional tool, particularly for the appropriately selected patients. But I wouldn't choose it simply because it's a newer technique. I would choose it when I believe it is the best way of creating the pocket for that particular patient and implant. So who might benefit from Preservé? In my practice, I think Preservé can be a very attractive option for selected patients wanting a relatively modest augmentation where their anatomy and tissues are suitable for the technique. If we create the pocket we need while minimising unnecessary tissue dissection, that makes sense. However, imagine a different patient who wants a substantially larger implant or has anatomy that requires more extensive modification of the pocket. In that situation, I may decide that I need a more controlled surgical dissection to position the implant properly. And I would rather perform the operation that I believe gives the patient the safest and the most predictable result than try to force their anatomy to fit a particular technique. Don't choose the brand, choose the procedure that's right for you. And this is probably the most important message of the video. I don't think patients should choose their surgery according to the name they've seen on the social media. Don't come to the consultation thinking, I need a particular implant because it's what I've seen online. Instead, tell your surgeon what you actually want, what size you are hoping to achieve, what shape you like, what concerns you have, and how important recovery is to you, and what are your priorities. Then, your surgeon can assess your anatomy and discuss the different ways of trying to achieve that result. I think Preservé is a useful addition to the techniques available out there. The reason to use it is because the technique is appropriate to your anatomy, your implant, and the result that you're trying to achieve. And equally, if a conventional dissection gives me a greater control and I believe it will produce a better result for a particular patient, that's a technique I would recommend. Ultimately, breast augmentation isn't about fitting the patient to the operation. It's about choosing the operation that fits the patient. And that's why a detailed consultation with an appropriately qualified and experienced plastic surgeon is very important. Make sure that they have the FRCS Plus, they're on the GMC Specialist Register, and all these other things that we discussed in our previous videos. My name is Dhalia Masud and I'm a plastic and reconstructive surgeon. Thank you for watching this video, and if you're interested in breast augmentation and want to know more about the various techniques, including Preservé, do contact us and I will see you in the next video. Bye.